Okay, we are back at Growing Smile Congress with Dr. Maria Vilarrasa. Hello, Maria.
Hello, Valerio.
Maria, thank you to be here for joining us. You have a lecture this afternoon, so we are very excited.
Yeah, it's my pleasure to be here. I think that it's a groundbreaking Congress, and I am very, very fond of being part of this new thing that's happening right now. We're making history, I think.
Yes, probably yes. I was thinking in the months before, probably maybe it's difficult to have a congress only focused on this topic.
Yes.
Instead, it works.
But I have to say that I was impressed that in Italy we had so many people, because right now in Spain it's something that it's working. I mean, we are very into interceptive. Probably if we get any growing smiles there implemented in Spain, we will have a lot of attendance. It's beginning to be a movement already.
I'm very happy for this.
Yes.
And in your lecture, you will talk about early class 3 with aligners.
Yes.
Wow.
I wanted to choose a topic that not many people talk about, because I think that management of class 3 is complicated.
Yes.
And I hope that I can throw a little bit of light in that.
But in your idea, do you think that it can become a gold standard?
I think that it's the gold standard. Managing class 3 aligners, class 3 malocclusion with aligners, it will become the gold standard. I am positive about that.
Wow. And what are the main advantages of using aligners?
Okay, so I always say that before we had a lot of appliances that worked nicely, but we had to work with a lot of them. We didn't have the whole integration. Right now, I think that we can do functional in a way in the primary stages, at the same time as we're doing management of teeth, which is the thing that I didn't have with functional therapy before. And at the same time, I can treat the jaw problem. So I think that it's, as I say, a 3-in-1 solution that really works so much better.
Wow. And at what age do you prefer to manage patients?
The youngest you can achieve it. I think that management of class 3, and it's in the literature, they constantly say that early mixed dentition, I go for primary dentition. I think that addressing class 3, especially functional class 3s, have to be dealt from day one.
Wow. Okay. And materials, the improvement of the materials, integrated features, do you think they can contribute in the management of malocclusion?
Absolutely. I think that all the companies are working hard to find the best material, the gold standard material. Right now, I'm dealing with the option of being able to work with an integration of soft material and hard material at the same time. And I think that I can show in the Congress that it's working beautifully. I think that the management of crowding in young patients, it's easier, but if we actually have better materials, it's even better. And then you said about integration of other features. That's the material is good to move teeth, but as we are seeing in the Congress, we see that functional appliances are important to be integrated. And if you can have them integrated in the plastic, then it's a groundbreaking thing.
Yeah, it's a big step ahead, no?
Exactly.
Okay. How do you choose the clinical case where to use aligners, where they are limited, if they are?
You're trying to make a spoiler here.
Yes.
No, so I do talk very thoroughly about this. I think that managing genetic class 3s is not really an option. We can kind of correct a little bit the function. We can help them. It's going to improve. I always say that it's better to try to give them best growth paths, but it can probably end up being a surgical case. But I constantly focus on functional class 3s, the pseudo class 3s, the ones that if you actually move the mandible a little bit backwards, if you go to centric relationship, they have the shift and they have a premature contact, and there is where we can work it. So that's why I say if you start from the beginning with really young patients, you will see a lot of functional class 3s. Eventually they grow to be a class 3, but if we get them in initial stages, those are pseudo class 3s. That's the ones that I like treating.
Okay. Maria, before you go, last question. What would you say to a colleague that consider aligners only useful for close-up diastemas or micro movement?
Okay, so what would I say?
Yes.
You need a lot to study. You need to come to Growing Smile Congress, and you need to understand how many things are we doing. I think that in all our lectures, we've been showing how we can deal with much more than just tooth movement. We are actually moving the muscles, the function, everything. So I think that people need to get a clear understanding and attend this kind of congresses to understand better.
Okay. Maria, thank you. Thank you for joining us.
Thank you.
Good luck for, you don't know, need, but good luck for your lecture.
Yes, thank you. And I'm going to look at the camera. Thank you so much.
Thank you, Maria.
Thank you. So